Broadcast is now starting. All attendees are in listen-only mode.
Hi, good afternoon. Thank you for joining us for an informational webinar on the Appendix K extension. My name is Jordan Grant, and I'm the Unit Manager for the Policy and Procedure Development Unit here at the Division of Senior and Disability Services. With us today is Division Director Tony Newman. Hi, Tony. Should we get started?
Sure, Jordan. Thank you. Shall we just move on to the next slide? All right, yeah, good afternoon, everyone, and thanks for taking time over the lunch hour so that we can talk about the Appendix K flexibilities. Along with Jordan, there's several of us from SDS on the line with me to provide information about the topic. Here's our mission statement at SDS, what we show up every day to try and do: promote the health, well-being, and safety for individuals with disabilities, seniors, and vulnerable adults by facilitating access to quality services and supports that foster independence, personal choice, and dignity. Next slide. Jordan, back to you for these housekeeping notes.
Thank you. I know many of you are familiar with GoToWebinar, but we did want to give a quick overview of how to engage. So this webinar is being recorded, and you can use the orange box. If you see, there's an orange box with a white arrow to find the menu. And feel free to put questions or comments in the question box. And then we always welcome questions to be sent to our policy inbox as well. And we'll have that email listed here in a little bit. Next slide.
All right, so right here in the simplest terms possible is what we wanted to convey today, that the flexibilities to SDS services that were going to end on November 11th are now extended. This isn't a blanket nationwide extension that's going to be the same for all states across the country, but it's happening because Alaska, and I'm sure many other states, want to keep a few of our flexibilities permanent. We need to revise our base waivers to do so. And under guidance from the feds to do so, we have to both submit waiver amendments and keep the flexibilities going until the amendments are approved by the U.S. Centers for Medicare and Medicaid Services. Most people are likely to greet this as good news, but in case this creates some uncertainty, we wanted to provide clarity for anyone that feels they need it, and a little bit about what we know the future holds. So next slide. Today, we are going to review the public health emergency timeline and the tools that were available to us, and then try and help all of you understand why the extension occurred and what comes next. Next slide. So first, some review. Senior and Disabilities Services administers several of its programs through Medicaid, the Joint Federal-State Medical Assistance Program. And when I think of the Medicaid-based programs that are provided through SDS, I think of them in three main categories or buckets. First is the Medicaid state plan, through which personal care services are provided. Second, the services that are authorized under Section 1915K of the Federal Social Security Act, also known as the Community First Choice Program. And third, the home and community-based waiver programs that are authorized under Section 1915C of the Social Security Act. Next slide. So when the pandemic hit, and the public health emergency was declared, the state's Medicaid programs were able to access a couple of tools that the federal government keeps handy to change the conditions under which we operate in emergencies, offering flexibilities to the way we authorize and allow services. The two main tools we turn to here allow changes to all three of those buckets of service that I just showed. The 1135 disaster relief was one of those tools, and then the famous Appendix K, an appendix to the 1915C waivers services that allowed us to adopt a whole host of flexibilities to our waivers during the emergency. Next slide. So those flexibilities were approved by CMS in early 2020. The pandemic proceeded, went on for a couple of years, and then early this year, I think it was February 2023, word was finally released that the public health emergency was going to end on May 11th. And that was a lot of work across the department. At SDS, we had to make plans for unwinding the flexibilities and those changes in services that had been allowed. Most Medicaid state plan services were designated to end on May 11th, as we'd known since the public health emergency began. But we also knew that Appendix K would have a different end date and that we would get an additional 6 months past May 11th for waiver services flexibilities to wind down, which would be November 11th. Next slide. So, public health is emergency, and November 11th is just a couple days away now. So where do things stand? First, community first choice personal care. State law was changed earlier this year through a bill, Senate Bill 57, to mandate the department to allow legally responsible individuals to provide community first choice, or 1915K, personal care services. And we had a webinar in late September where we discussed that. And I would encourage you to go to the SDS YouTube channel if you were unable to participate and would like more information about how that's going to proceed. Then there were the flexibilities to the Medicaid state plan services, and most of those ended on May 11th, but we got special permission from CMS to continue the flexibility that allowed legally responsible individuals to provide personal care services until May 11th. And that will end on November 11th, on November 11th, to be clear. And that will end on November 11th. Federal regulation expressly prohibits the use of legally responsible individuals as providers of state plan personal care services. And then finally, Appendix K. To repeat what we said at the opening of the teleconference, Appendix K flexibilities that were on track to end on November 11th will continue. And that's due to a clarification that SDS received from the federal government just a few weeks ago. They will continue to remain in effect while CMS reviews the waiver amendments that we are submitting. And I wanted to pause here for a moment and acknowledge that this turnabout and the changing and uncertain end date for the Appendix K flexibilities may be confusing and frustrating. It has been a bit awkward for us too, because we had been asserting clearly for many months that November 11th was going to be the end of the Appendix K flexibilities, full stop. But hopefully more people are happy they're going to be able to continue to access the flexibilities and are relieved to see them continue. But undoubtedly some are frustrated by the change in direction, especially those of you that have already taken steps and adjusted to be ready for the flexibilities to end on November 11th. I want to thank you for getting prepared for the flexibilities to end. We encourage you to continue making alternative arrangements for once the flexibilities are discontinued. So slide 10. Which waiver flexibilities are extended? So since we only have an hour together here, we're not going to detail out which flexibilities are extended, but I will refer you to the e-alert from SDS on October 27th, where we announced this and provided a 2-page, simply stated list of those flexibilities that are going to be extended. And this is a picture of the front page of that list. We also included in our e-alert a letter that can be shared with families and puts all of this into plain language. So if you are a provider or a care coordinator with families that would benefit from more information about this change, please feel free to forward that letter to them. We created that as a resource for you to help explain the changes. And so we encourage you to share it with anyone who might have questions about how this will impact them.
And Tony, can I jump in here for a second before we go to the next slide? I just want to point out for everyone, if you go to your GoToWebinar and you see your orange control, your orange arrow, if you keep going down, there's a section called handouts. And we've actually put a PDF of the e-alert and the accompanied attachments right there for you. So if you didn't get the e-alert, you can go ahead and look at it right there. It has a list. And if you have any questions about that, we do encourage you to pop them into the questions box.
Excellent, Jordan. Thank you. Okay, next slide. So when will the flexibilities end now? Well, just to be clear, the end of the flexibilities is now tied to the proposed waiver amendments. And we are requesting at SDS from CMS that the flexibilities be extended until June 30th, 2024. CMS may or may not approve that effective date that we are requesting. But we are hoping that the deadline for the unwinding will most likely be on June 30th, 2024. That is subject to CMS's approval. So that's the assumption that we're going to be working on for you until further notice. Jordan, back to you.
Thank you. So we do want to share a little bit more about what you can expect in the next coming months. So as Tony mentioned, the waiver flexibilities are tied to the proposed waiver amendments. And the proposed waiver amendments ask CMS to allow us to continue some of the flexibilities permanently under specific conditions, such as the ability for legally responsible individuals to provide in-home support and supported living, and the changes to residential habilitation to allow for new options for individuals who may require complex care. SDS held some webinars in September to review the proposed waiver amendments and to solicit public input. And we appreciate all of your comments and engagement. It was wonderful to hear from so many folks, and we really appreciate your engagement with that. So what's next? SDS is planning to submit the proposed waiver amendments this week. And there is a little bit of a recipe that we can expect CMS to follow here. So CMS has 90 days from the date of our submission to approve or deny the amendments. This means that we can expect that if they're going to approve them, it's going to be about mid-February. There may be some back and forth with CMS during that time, but in general, we expect about a 90-day clock. And waiver amendments are a little bit funny. They have an approval date, which is the date that CMS approves them. In this case, it's likely to be sometime in February 2024. And they also have an effective date. And the effective date can be different than the approval date. And CMS told us that we can request a future effective date so that we have time to unwind the flexibilities. So SDS will be requesting an effective date for the waiver amendments of 7/1/2024, so July 1st. And this would mean that the Appendix K flexibilities would end on June 30th. You may notice that I'm saying we will request it. So CMS ultimately will get to decide on the effective date. And although we hope they will honor our request, it is possible that they will select a different effective date. And that effective date could be sooner than June 30th or July 1st. But at this time, we are making plans with the best information that we have available, which is that we are requesting an amendment start date of July 1st. And therefore, we are requesting that the flexibilities will end June 30th. Next slide, please. So what does this mean for you? First, I would like to thank everyone who has already taken the steps to prepare for the flexibilities ending. I know you've heard it before from us, but please proactively make plans for unwinding now. It does seem like June is a long ways away, but we know it's going to be here before we know it. And second, if you haven't already signed up for SDS e-alerts, please do. We want to be able to get you the most up-to-date information as soon as we have it. And that is our best tool for getting the word out. And finally, we expect more information about when flexibilities will be ending in February or March. Again, this is because we expect CMS to approve or deny the amendments about 90 days from the day we submit. And at this point, we will have a more definitive end date for Appendix K flexibilities. Until then, we're going to be operating as if they will end June 30th. But again, this is subject to CMS approval and it may change. Next slides.
Yeah, thank you, Jordan. And so to summarize, the flexibilities allowed on November 10th will still be allowed on November 12th. The November 11th date is now suspended as a deadline for the flexibilities, the Appendix K flexibilities currently in place. And as Jordan just said, SDS will be sending out more information when we have a confirmed end date. And I want to just thank you all for being here and for your work. The public health emergency, it's been quite a marathon. And maybe some of you have only begun providing or receiving services through SDS since the pandemic began. and aren't familiar with how things worked before Appendix K. So the potential loss of these flexibilities may be causing some uncertainty and stress. I myself only joined SDS in early 2020, so providing services under the Appendix K authority is the approach I've known throughout my time here. The good news is that this guidance from the Centers for Medicare and Medicaid Services not only provides us with more time to adjust to life without the Appendix K, it'll provide us with an opportunity to unwind with regulations and waivers that we hope will better meet the needs of those we serve and those of you that serve them. Thank you. Jordan?
Next slide, please. So I gotta say, I'm impressed. We have blown through this presentation much quicker than we anticipated. And that's impressive also because this is tough stuff to kind of understand the ins and outs of CMS and why we may not have a definitive end date for some of these flexibilities that have been extended. So at this time, we would love for you to put any questions you have into the chat. And I want to be clear that, you know, today is not necessarily a question and answer session, but we do want to hear areas that you feel you need more resources. Because if we are getting a lot of the same type of question, what that tells us is that we need to put out more information and guidance in that area. And so we welcome you to please put into the chat any questions or comments you may have. GoToWebinar is really great because they do actually record all of the comments. So even if there's questions that we're not going to be able to answer today, we are able to take them back after this, take a look at them, and see what that means for us and whether we need to put out more resources or more guidance in that area. Additionally, I just want to point out, if you have specific questions, especially if there may be case-specific questions, you can always send them to hss.dsds.policy@alaska.gov or contact the amazing SDS training team for assistance. I know many of you are familiar with office hours and things like that, and so if you have a really specific question, maybe with details that you wouldn't want to share, we would welcome you to go to one of those venues to get your questions answered. This webinar also, you know, it's been recorded and it will be available on the policy YouTube. We can go ahead and put in the chat where you can find the link to that. And at this point, we can take a look and see if we have any questions. Not sure if Kara or Kat or Delight can help us a little bit with that.
Oh, Delight, we can't hear you.
We can't hear you quite yet.
There's Delight and Kat.
I was popping in to say, sorry, I'm having a hard time getting back my camera on, and then I can't hear Delight.
It was my fault. As you can see, I'm presenting for Tony and Jordan, so you can now see my closed captioning. So I muted my mic earlier, so sorry about that. We are getting quite a few questions about respite in the chat, that respite that was approved through flexibilities, and teams wondering if they need to make amendments to their current plans that were approved, if they need to, if we're bringing back the AppK form. So there's two kind of thoughts here, and one of them is the term AppK. Can you describe the difference between policies units like use of AppK and maybe what training units use of AppK has been? Training has taught AppKs as being a short form that was used during the pandemic that we've now faded. What does AppK mean to you guys?
I can start, Jordan.
Yeah, go ahead.
That's a great question. I've heard AppK refer to a couple of different things over the years that the pandemic has been in effect. To me, the Appendix K refers to the blanket Appendix K as it's attached to the 1915 C waiver language in the Social Security Act. So it's encompassing of the entire ability to request flexibilities, not just related to support plans, not just related to legally responsibilities, but is the bucket that is inclusive of everything that was changed related to the public health emergency.
Thank you. So the big clarifying point here is that when we're talking about App K right now, we're talking about this package that goes to CMS. The App K form that was used during the pandemic has been retired. It's gone. So just trying to keep those thoughts really separated in this conversation.
You know,
yeah, go ahead.
Just an interesting thing is when the division needs to ask for permission from CMS to make changes. We have done that over the course of the past 3 years through, I think, well, Jordan, correct me if I'm wrong, but I think about 10 different requests. So the Appendix K has actually come in the form of 10 requests. Some of them containing many flexibilities requested, some of them just a few. So to us, the Appendix K is inclusive of all that work that's been done over the past 3 years to request flexibilities to the waivers. I'm sorry, Jordan, were you going to say something?
I was just gonna add on to what Delight was saying, which is I think a main takeaway for today that I hope people take with them is that this extension applies to flexibilities that were set to end November 11th. And if there were other things that ended already, those things are not being extended because they've already ended. So things like the Appendix K short form, I realize it says Appendix K short form, but that has actually been replaced with a permanent short form option. So those would not be things that are going to be extended. And I would just recommend people refer to that list of things that are on the e-alert. And then another tool I have found really helpful for thinking about what flexibilities are going to be extended is thinking about, if you were allowed to do it on November 10th for waiver services, you will be allowed to do it after November 11th at this point because of the extension. But if it was something that had already ended prior to November 10th, it's not something that's going to be extended because it's already ended. So that is sometimes a helpful framework to think about some of these.
Right, and it's not in the Appendix K, but the only exception to what you're talking about, Jordan, is personal care services provided under the state plan by a legally responsible individual.
Right, right. Because because that is under our 1135, we got special permission, and that will be ending November 11th. So, once again, because it's confusing stuff, for CFC personal care services, an LRI will be able to continue providing that service after November 11th, partially because we did have a bill pass and get signed into law this summer, SB 57, that did allow for that. So that will continue to be allowed, but state plan personal care services provided by a legally responsible individual will be ending November 11th. And then all of the waiver services that had an extension that was still in play on November 10th will still be able to continue at this point, we hope, until June 30th. But again, that will be up to CMS to determine if they will approve our requested effective date.
So if teams have already made plans and things have been turned in, do they need to change anything at this time? Like because of these changes, because of this extension? Is there any action that people have to do because there's been an extension?
That's a good question. I don't believe so. I think if you've already made arrangements and you have, we appreciate it because I know we've said multiple times that things were ending and then they would be extended. This time, this is the end. This is going to be the last extension. So once these proposed amendments become effective, it will be the end of App K flexibilities. It's just that we're not positive on that end date. but we appreciate everyone who's made arrangements. If for some reason this extension changes what changes the needs of the participant, then we would definitely recommend working or bringing that question to office hours, seeing if amendment might be necessary. But in general, we don't think any action will be required.
So if your plans are in, you don't need to change anything unless the person's needs change and you need to make adjustments to the support plan.
Right.
Thank you.
Thank you, Delight.
Would you like me? Oh, go ahead.
Oh, I was just going to say, I'm looking at some of the questions here, and I do see some themes that we're going to want to take a look at and probably put out some more guidance around. But our questions have really slowed at this point. So I think we'll give another minute or two for any additional questions. And at that point, I think we can wrap up early and give people a little bit of their lunch hour back. Again, we have all of the comments and questions here. So if we didn't answer your question today, don't feel like you're not going to get an answer to it. It just means that likely a lot of people had that question, and we probably want to put out some an actual resource about that, because it was a pretty common question. So feel free to get your last minute questions in here. And
Jordan, just to sort of restate what you said earlier, we were thinking that around February, March, we would be following up just because if there was, just to fill a vacuum, if people were wondering where we were with regard to approval from CMS. It'll just be a good timing to do a check-in. And certainly if we hear anything earlier, if we understand anything earlier, we'll get word out to people earlier.
Yes, absolutely. Yeah, and again, we would love it if everyone is signed up for e-alerts, so we can make sure that if we have news to share, we can get that news out to you as quickly as possible, because we want to have you be the first to know with us when we know what that end date actually is. And so what we would expect is that CMS will review our proposed amendments. There's inevitably quite a bit of back and forth questions that they have. And one of the very last things they'll determine is that effective date, because they're not going to determine an effective date before they decide if something's going to be approved or not. And so as soon as we have news on that, we will be sharing that, because we want to give people as much lead time as possible to work on unwinding. And again, we're really hoping that CMS is going to honor the request for the proposed effective date to be 7/1, which would make the end of waiver flexibility 6/30. But we don't have a guarantee on that. So we definitely think please sign up for e-alerts. Please keep an eye on things. Please keep sending questions in, because we appreciate it. It helps us know what the needs for more resources are. And we will do our best to get the word out as soon as we have any news. And with that brings us to the end of our content for today. So thank you so much for joining us on your lunch hour. We appreciate it.
Thanks, everyone. And Jordan and Delight, thank you for your help.
Thank you.
All right. Have a good afternoon.